Where do people go when they need medical care? Where do you go? Let's hope that if you or a loved one are in risk of losing life or limb, that you're headed to the emergency room. And let's hope that if you need a refill on your blood pressure medication, that you're not. You'd call and make an appointment with your family doctor, right? Well, in healthcare, there is a new player on the field. It's a game changer. It comes in the form of walk-in clinics. That's what I do. I'm a nurse practitioner in a walk-in clinic, and I love what I do. And patients love us. We are affordable and we are approachable, and we're open extended hours, including weekends and holidays. Patients love that. The industry has shown rapid growth in recent years. The problem is the industry has grown faster than standards of care can be developed. It is also very difficult to standardize an industry that has such variability in the services provided and expertise of healthcare workers at the different facilities. But it's confusing for patients. They don't always know where to go. Patients love to use this as primary care. And as much as we love our patients, we can't take the place of a primary care provider. Patients also try to use this like an emergency room. And while I understand we are less expensive, we also do not provide the same level of care as the emergency room. This is why I chose to do my project on chest pain. The name of my research project is the implementation of a rapid chest pain protocol in a walk-in clinic. I developed a protocol to risk stratify patients into level of risk for chest pain that is caused by a cardiac cause. And really, the purpose of my study was to increase confidence in the clinicians to retain low-risk patients that have been stratified by the Marburg Score. Now, I use the Marburg Score as an assessment tool to risk stratify patients, and I chose this tool because it does not require a troponin level. It is a 5-question questionnaire. There are other very validated assessment tools for chest pain, such as the heart score or the TIMI score, but they require troponin, which is not available at my clinic. I had 26 participants in my study. 8 of them met criteria for an EKG. 4 of those had EKG changes and were appropriately sent to the emergency room. The 2 of them were having a heart attack. 2 of those had a new onset of a heart rhythm change. The remaining 22 participants were retained in the clinic and were appropriately assessed, diagnosed, and treated for non-heart related problems. Those 22 patients remained free of a heart-related problem and follow-up in 30 and 60 days. So do patients who are risk stratified with the Marburg score have less risk of being sent to the emergency room unnecessarily? Yes. 100% of the patients in the study were appropriately sent to the correct level of care. So we can conclude that the positive and negative predictive factor for low-risk patient was 100%. So what we can take from this study is when people are seeking medical care, no, wait, when people like you walk into clinics like mine and see clinicians like me, we just want you to know that we're doing our very best to provide you with the highest standard of care. Thank you.